Preparing for old age, protecting health and maintaining independence. Old age is an inevitable stage of life, but not everyone is adequately prepared to enter this phase in a healthy and independent manner. Many people neglect early healthcare, leading to physical and mental decline, and a loss of autonomy in their later years. To enjoy a healthy and meaningful old age, we need to plan for it from a young age. This article will analyze common health issues in the elderly and suggest measures to help maintain long-term physical, mental, and independent well-being. Health challenges in the elderly. Physical decline. Over time, the body gradually ages with signs such as muscle loss and weak bones. After the age of 30, the body begins to lose about 3 to 5% of muscle mass per decade. This condition is known as sarcopenia, an age-related muscle decline. This is a significant concern as it not only reduces physical strength but also affects mobility, increasing the risk of falls and injuries. Additionally, bones weaken over time, with bone density gradually decreasing, making them more brittle and prone to fractures, especially in people over 50. This condition is known as osteoporosis, and when combined with sarcopenia, it significantly increases the risk of disability in the elderly. Degenerative joints and bones. These are major issues that affect mobility and daily activities. As bones weaken, they become more vulnerable to injury, leading to fractures, chronic pain, and a gradual loss of independence. Osteoporosis is a condition where bones become brittle and prone to fractures due to bone density loss, commonly affecting the spine, hips, and wrists. Arthritis is a condition where joint cartilage wears down, causing pain, stiffness, and limited movement. Reduced bone density is an early stage of osteoporosis, where the amount of minerals in bones decreases, causing them to weaken over time. These issues often occur simultaneously, making it difficult for the elderly to walk and move, and increasing their risk of severe injuries. Weakened cardiovascular system. As we age, arteries in the body gradually lose their elasticity, impairing blood flow and increasing pressure on artery walls. This leads to a high risk of hypertension, cardiovascular disease, and stroke. Stiffer artery walls also force the heart to work harder to pump blood throughout the body, which can eventually lead to heart failure or other cardiovascular complications. Furthermore, decreased blood vessel function reduces the supply of oxygen and nutrients to the brain, increasing the risk of stroke, memory loss, and neurological disorders. Slowed metabolism. As we age, the digestive system also declines, reducing the efficiency of nutrient absorption. The body no longer absorbs essential vitamins and minerals such as calcium, vitamin D, vitamin B12, and iron as effectively, leading to a risk of nutritional deficiencies. This can result in malnutrition, weakened immunity, osteoporosis, and muscle loss. Conversely, some elderly individuals experience weight gain and obesity due to a slowed metabolism and no corresponding decrease in calorie intake. A sedentary lifestyle, combined with an unhealthy diet, can lead to excess fat accumulation, particularly in the abdominal area, increasing the risk of diabetes, cardiovascular disease, and high blood pressure. Mental and psychological decline. Dementia, a common syndrome in the elderly, characterized by a gradual decline in memory, thinking, information processing, and the ability to perform daily activities. Major conditions causing this include Alzheimer's, Parkinson's, and mild cognitive impairment. Dementia not only affects individuals but also places a significant burden on families and society. Depression and loneliness. As people age, many face significant life changes such as the loss of loved ones, retirement, declining health, and reduced participation in social activities. These factors can lead to prolonged feelings of loneliness, increasing the risk of depression. Depression in the elderly not only affects mental health but also has a negative impact on physical health. People with depression often lose interest in life, have poor appetite, insomnia, chronic fatigue, and even an increased risk of cardiovascular disease and cognitive decline. Sleep disorders. Sleep plays a crucial role in body recovery and overall health maintenance. However, as we age, the body produces less melatonin, a hormone that regulates sleep, making it difficult for the elderly to fall asleep or stay asleep at night. Many elderly people have difficulty maintaining deep sleep, leading to fatigue, memory loss, and negative effects on both physical and mental health. Dependence on others. As health declines, many elderly people are no longer able to care for themselves. From basic activities such as eating, personal hygiene, and mobility to managing medications and finances. This leads to dependence on family or healthcare facilities, reducing quality of life and creating pressure on relatives. Common mistakes and solutions. A healthy and independent old age does not happen naturally, it requires early preparation. However, many people make serious mistakes in health and financial care, leading to difficulties in their later years. Mistakes in physical health care. One of the biggest mistakes is only paying attention to health when illness appears. Instead of preventing disease from a young age, an unscientific lifestyle can lead to many serious health problems in old age, weakening the body and reducing quality of life. Common mistakes. Not having regular health checkups. Many people skip annual checkups, leaving conditions like diabetes, high blood pressure, and osteoporosis undetected and untreated. Lack of regular exercise. A sedentary lifestyle weakens muscles, reduces bone density, and increases the risk of falls. Unhealthy diet. Eating too many processed foods, few vegetables, and insufficient protein and calcium can lead to obesity, osteoporosis, and chronic diseases like cardiovascular disease and diabetes. Mistakes in mental health care. Old age not only involves physical changes but also profoundly affects mental health. However, many people neglect mental health care, leading to depression, disorientation, and rapid cognitive decline. Common mistakes. Feeling lonely but not seeking improvement after retirement. Losing jobs and social relationships. Many people feel isolated but do not actively participate in new activities. Lack of mental exercise. Not reading, learning, or engaging in stimulating activities increases the risk of Alzheimer's and dementia. Lack of social connection. Not maintaining relationships with friends and family leads to negative emotions and depression. Mistakes in financial planning. Besides physical and mental health, finance is a crucial factor determining quality of life in old age. However, many people do not prepare financially adequately, leading to difficulties in paying for medical and living expenses. Common mistakes. Not accumulating finances early, only worrying about living and medical expenses in old age. Over-reliance on children. This not only puts pressure on the family but also reduces autonomy. Lack of knowledge about insurance or support programs. Ignoring solutions such as health insurance, pensions, or support funds for the elderly. Solutions for a healthy and independent old age. Old age does not have to be associated with declining health and loss of independence. With good preparation, we can maintain a healthy body, a sharp mind, and a quality life even in old age. Here are 3 important factors to help you prepare well for old age: proper nutrition, regular physical activity, and mental health care. Proper nutrition. Nutrition is a crucial foundation for maintaining long-term health. A balanced diet can help reduce the risk of chronic diseases such as cardiovascular disease, diabetes, and osteoporosis. Important nutrients for the elderly. Protein supplementation. After 30, muscle mass gradually decreases over time, so eating enough protein helps maintain muscle and strength. Good protein sources include lean meat, fish, eggs, milk, soybeans, and almonds. Calcium and vitamin D. Calcium helps strengthen bones, while vitamin D helps the body absorb calcium better. You can supplement from milk, cheese, salmon, sardines, and green leafy vegetables. Healthy fats. Omega-3 found in salmon, flax seeds, and walnuts helps protect the cardiovascular system and enhance brain function. Fiber and water. The digestive system of the elderly often functions less efficiently, leading to constipation. Fiber from green vegetables, fruits, whole grains, along with drinking enough water, helps the digestive system function better. Things to avoid. Limit processed foods, high in sugar, salt, and unhealthy fats. Avoid alcohol and tobacco, as they can accelerate health decline. Regular physical activity. Exercise not only helps maintain shape but also strengthens the immune system, protects joints, and improves cardiovascular health. The elderly should choose exercises suitable for their physical condition to maintain flexibility and muscle strength. Suitable exercises for the elderly. Strength training, squats, push-ups, or light weightlifting help maintain muscle and prevent muscle loss. Flexibility and balance exercises, yoga, tai chi help improve balance and reduce the risk of falls. Daily walking. This is a simple but very effective exercise for increasing blood circulation, improving cardiovascular health, and maintaining endurance. Tips: maintain at least 30 minutes of exercise per day, 5 days per week. Choose exercises suitable for your physical condition to avoid injury. Mental health care. Mental and intellectual health are just as important as physical health. An optimistic spirit helps prolong life and reduces the risk of stress-related diseases, depression, and cognitive decline. How to maintain an optimistic spirit. Participate in social activities, meeting friends. Joining clubs or classes helps maintain social connections and avoid feelings of loneliness. Exercise your brain. Reading books, playing chess, learning new languages, or participating in intellectual games helps keep the brain active and reduces the risk of Alzheimer's disease. Practice meditation and mindfulness. Meditation helps reduce stress, improve sleep, and enhance mental well-being. Things to avoid. Do not isolate yourself. Maintain social relationships. Do not spend too much time sitting still. Try to move gently and regularly. Mrs. Land's story. A healthy and happy old age. Mrs. Narcissus, 75, a former teacher, has a habit of exercising every morning. In retirement, she not only maintains a scientific diet but also joins a book club and painting classes, keeping her spirits high. Thanks to regular health checkups and consistent exercise, she can still walk, cook, and participate in social activities without help from her children. Mr. Min's story. A lesson in senior health. In contrast, Mr. Charlie, 72, neglected his health early on, was sedentary, and often ate processed foods. In his old age, he suffers from many chronic diseases such as diabetes, high blood pressure, and osteoporosis, making walking difficult. Due to a lack of financial planning, he has to depend on his children, putting pressure on the family. These two stories show that early preparation can make a significant difference in life in old age. Old age does not have to mean weakness or dependence. It can be a time to enjoy life if we prepare properly. By taking care of our health early, maintaining physical activity, nurturing an optimistic spirit, and making sound financial plans, everyone can aim for a healthy, independent, and meaningful old age. Take the initiative to invest in your future today to enjoy a fulfilling life in your later years.